Everyone. My name is Carol Timmings, and I'm the president of the Registered Nurses Association of Ontario. Joining me is RNAO's Chief Executive Officer, Dr. Doris Greenspan, and I would like to thank everyone for coming today. RNAO is the professional association for registered nurses, nurse practitioners, and nursing students in Ontario. Our mandate is to advocate for healthy public policy, and that's why we're gathered here today. In less than 4 months, we will go to the polls to elect a new government. Nurses consider the right to vote an immense privilege and a serious responsibility. We represent the largest group of health professionals in the province, and we play a central role in the health of individuals and communities. Our day-to-day work provides us with a window on the impact policies have on people's lives. We know the health system inside and out, and we know how to make it function better for the benefit of all Ontarians. We use our knowledge and expertise in all roles and sectors of the system, and we look after people of all ages, all social classes, all ethnicities, all religions, all sexual orientations, and all gender identities. That's why we are proud to help inform and influence the discussion around issues that must be front and center in the coming weeks and months before releasing the platform of policies that, in the view of nurses, all political parties in Ontario should adopt. These are thoughtful, evidence-based policy recommendations that cover key areas such as access to nursing care, our health system, living standards for Ontarians, our environment, and our government's fiscal capacity. The title we chose for our platform was deliberate: Improving Health for All. It's based on the principles of equity, dignity, fairness, and respect. Respect for all, and especially for people who are marginalized and vulnerable and believe they do not have a voice. The recommendations we propose are key to building a more inclusive society, one that leaves no one behind, and one that will make our province a better place for all. An essential component of improving health for all is ensuring access to nursing services. As I mentioned earlier, we represent the largest group of health professionals. We are the first point of contact for many people accessing the health system in times of health and in times of illness. The first point is primary care. Any examination of the most effective health systems around the world points to those that have strong primary care systems in place. Moreover, those high-performing countries anchor their health systems in primary care. We think Ontario should be a Canadian leader in this area, and that's why we need more RNs in that sector fulfilling their important role of coordinating people's care. Improving access to nursing care is possible, and that's why we urge all parties to locate care coordination and RN coordinators in primary care settings. There is clear evidence linking care provided by RNs with better health outcomes, improved patient satisfaction, and better financial outcomes for the health system. RNs are proud of their education, skills, and expertise. We consider ourselves partners in health with our patients, health organizations, and the health system as a whole. But the number of RNs per population in Ontario is at an all-time low, failing to keep pace with the province's growing and aging population. The latest figures tell us that there are 703 RNs per 100,000 people in Ontario. Compare that with the national average of 839 RNs per 100 people. We know the cause. For the past several years, RNs have been replaced by less qualified health workers. This compromises patient safety and is financially more costly to taxpayers. Improving access to nursing care is possible. Nurses urge all parties to require that all new nursing hires in tertiary, quaternary, and cancer care hospitals be RNs. RNAO urges all parties to require that all first home health care visits be provided by an RN. And finally, legislate health human resource standards in long-term care so that there is at least one NP for every 120 residents, and a staffing mix that consists of 20% RNs, 25% RPNs, and no more than 55% personal support workers. NPs have been delivering effective care for people for decades. RNAO has been a champion for increasing their scope of practice. We are proud that they are delivering more advanced care today than a decade ago. People have benefited from their expertise in primary care, NP-led clinics, community health centers, Aboriginal health centers, and family health teams. They are playing an important role in hospitals where they can now admit, treat, transfer, and discharge patients, and in some long-term care homes where residents are benefiting from the expert care being provided by attending NPs. However, barriers to NP practice remain, and that's why we urge all parties to ensure that nurse practitioners work to their full scope by authorizing them to perform point-of-care testing, order all diagnostic imaging and ECGs, complete all medical forms for mental health services, and by expanding their authority to certify a death. The same is true for RNs. They are fully capable of doing more, and that's why we urge all parties to ensure RNs can order lab tests, communicate a diagnosis, and prescribe medications for common ailments. This has been happening in the UK for the past 15 years. Isn't it time for Ontarians to have their access to health care dramatically improved? And since we look ahead to the future and consider the education of students in nursing schools, we also urge all parties to integrate RN prescribing into the baccalaureate nursing curriculum by 2021. Acknowledging the existing expertise of RNs is important, particularly when it comes to ensuring patients have access to health services that RNs have been providing for years. Psychotherapy is one such area, and that's why we urge all political parties to commit to allow RNs to continue initiating the controlled act of psychotherapy. Now, I would like to ask RNAO's Chief Executive Officer, Dr. Doris Greenspan, to share our recommendations on the health system and the other areas of our platform. Doris?
Thank you very much, Carol, and good morning, everyone, and thank you for coming. We love having a standing room, I must say. Improving Ontario's health system. Ontario marked a major historical first this past January when it began providing essential medications to those under the age of 25. It was an important step towards a long-held belief that our universal health system is not complete until it includes drug coverage for all. In fact, Canada is the only developed country that doesn't have it. Improving Ontario's health system is possible. That's why nurses urge all parties to implement a universal, single-payer pharmacare program that covers all medically necessary prescriptions without deductibles, co-payments, or user fees, or mean testing. And since oral care is a predictor of overall health, nurses also urge all parties to invest $10 million to support oral care for low-income adults and seniors. It's an investment that will pay for itself because right now, 17% of our province's population cannot afford dental care and must turn to more costly and less effective health services when pain in their mouth becomes unbearable, or worse, affects their overall health. Another area where we need to do better to improve the lives of people is those who live in long-term care. Nursing homes are exactly that, homes for seniors. But sadly, and despite the best efforts of nursing staff, the experiences of seniors are not always dignified, comfortable, or even safe. Many people in Ontario are not aware that nursing homes that adopt evidence-based clinical best practice guidelines, such as those aimed at reducing falls or improving incontinence, are unintentionally penalized when best practices improve residents' outcomes. Their funding, in fact, is decreased. This makes no sense. And that's why we are urging that this be changed. Politicians and the people of Ontario need to know this because most don't. Put it simply, current funding models that have been for at least a couple of decades in long-term care actually discourage improvements in residents' outcomes because funding drops when homes are able to lower residents' complexity and acuity by either preventing or addressing problems. It's not intentional, we know it, but it's simply not right. It's the way the model has been set up for decades, and it's simply wrong, and it must and can be changed. We can do better. And that's why we urge all parties to continue to support the use of evidence-based practices in long-term care homes to promote and sustain improvements in residents' health. And for that, we thank the government because we have partnered on that and delivered good outcomes. At the same time, though, as we realize, the funding is pulled away when the outcomes improve the situation of residents. So we are urging all parties to include in their platform to review the funding model in long-term care so that funding is not cut when homes deliver better outcomes. And yes, we have ideas of how to go about that. We also need to do better to leverage the improvements that exist today as a result of technology. Information is more accessible than ever, but that's still not true in healthcare. It's amazing. You can hold your visa, but you cannot hold your health information. Making health information more accessible will help people make informed decisions about their care. That's why nurses urge all parties to provide every Ontarian with their personal health record. Taking care of people, health, needs must also include Indigenous communities. As residents of Ontario, we must be mindful of our record when it comes to those who were on this land before us. Governments, one after another, have not done much as they should to improve the lives of Indigenous people. That's why we urge all parties to work with Indigenous communities and their leaders to tackle basic social determinants of health and prevent children and youth suicide, and to transform our health system from its colonial approach into an Indigenous-led self-governance model. Let's talk about our living standards. Good health means many things. It's about staying healthy and having access to what it takes to be healthy in the first place. For many people in Ontario, good health depends on where they live and how much income they have to live on. An estimated 1.9 million people in our amazing province live in poverty. Nurses know that it is hard to put your health first when you worry about where your meal will come from, how you will pay for the rent, or worse, where you will sleep at night. Since January 1st of this year, many Ontarians have benefited from the latest increase in minimum wage, and we thank Premier Wynne for that. It has put more money in the pockets of the working poor. To ensure we keep improving the living standards of those still struggling to get by, we urge all political parties to maintain the commitment to increase the minimum wage to $15 per hour on January 1st, 2019, with no exception or exemption of age or sector. Many people still lack adequate housing, a critical obstacle for good health. That's why we recommend that all parties commit to invest 1% of the province's overall budget, that is $1.5 billion, yes, to build new units of affordable and accessible housing and to repair the backlog of units that are in need of repair. And since we know that more needs to be done to meet the needs of vulnerable people living with mental health and addiction challenges, we are calling on all parties to create 30,000 units of supportive housing to be built over the next 10 years. Let's not forget that less than 2 months ago, we were shivering in the grip of another deep winter freeze, one of the worst we have had in the last decade. The sustained cold temperature over several days and weeks in December and January exposed brutally the urgent need for action when it comes to health and lives of homeless persons. This issue is not just Toronto's problem. On any given night in this province, there are 12,000 people without a place to call a home. That is tragic not only for those who are forced to live on the streets, but shameful for us all as a society. Shelters across the province are over capacity. That is why an important policy imperative is that all of Ontario parties commit to work with other levels of government to address homelessness and ensure adequate shelter space in communities across the province. And I want to emphasize that this work should take place with input from those with lived experience. We need to address this issue once and for all and ensure that persons who are homeless have solutions that meet their needs. And on that, I invite you this afternoon to hear a panel that will include people with lived experience. Like many Ontarians, nurses are acutely aware of climate change, so I do want to speak now about improving our environment. By doing our part to combat its effects, we are not just protecting the environment, we are also protecting people's health. Ontario is to be applauded for the work it has done on the environment. It has taken major steps, in fact, major steps in all of North America, like, for example, closing coal-fired power plants, banning the cosmetic use of chemical pesticides, which, by the way, we celebrated at RNAO offices with Minister Gerritsen back then, expanding the use of renewable energy, and has taken also a leading role in reducing greenhouse gases. Despite the progress today, though, we are still far from where we need to be. We need to reduce greenhouse gas emissions even more. We also need to invest more money in transit and forms of active transportation such as cycling. The momentum created to date cannot and should not stop. Improving our environment is possible and is urgent. Without an environment, there is no health. That's why we are urging all parties to ensure that the provincial carbon pricing system allows Ontario to meet its greenhouse gas emission targets. We also ask that all parties make polluters pay for the full cost of the pollution they create. Work with federal and municipal governments to ensure dedicated and sustainable revenue sources to pay for the expansion of transit and active transportation. So, how do we pay for all of that? I'm sure some of you are asking us. Well, we actually do look at that every single time we put ideas. We recognize that it takes money to deliver the programs required for a healthy society that includes everyone. Government officials will tell you there is only so much money in the pot. But the reality is that Ontario spending on a per capita basis is much lower than that of other provinces. In fact, the share of our provincial gross domestic product that goes to program spending is the lowest in the country. Not a good thing. Lowest number of RNs, lowest per capita spending. Ontario can have more money at its disposal for all the social, environmental, and health programs if it collects more revenue. Ontario can improve its fiscal capacity and should do so. That's why we urge all parties to build a more progressive tax system by making those who earn more pay more. Increase sources of revenue that encourage environmental and social responsibility. Reject the further sale of any public-owned crown corporation and government asset. It's simply not good business. Ensure transparency and accountability in all fiscal measures and transactions. As nurses, we care about our patients. We care about the health of Ontarians, and we care about improving health for all. We urge politicians of all parties to adopt our policy recommendations, and we encourage members of the media and voters to review our policy platform in detail. Together, we can and we must improve health for all. Thank you, and we will entertain some questions. And if someone can give the seat to our colleague, Francelina, that will be lovely. Here you go. Thank you. Please go. We have all the three parties there. You need to go.
Hi. Can you elaborate on why you're calling for universal pharmacare?
First of all, there is not a single developed country, OECD countries I'm referring, that doesn't have pharmacare. It financially actually costs less, right? It delivers better health outcomes. You cannot do health system transformation and move people to more community care if you don't have pharmacare, right? Drugs are covered in the hospitals, but drugs are not covered when you are in home care, depending on your situation. So a pharmacare program, if you look at all the calculations and all the studies that have been done, deliver better outcomes at a lower cost. So,
I hear you calling for universal pharmacare, but I didn't hear the word national. Does pharmacare need to be national, or could Ontario go it alone?
So Minister Hoskins will be the first to tell you that what we have said to him, if the national government doesn't go there, Ontario doesn't need to wait. So Tommy Douglas started Medicare in Saskatchewan, and then it became national. Eric Hoskin can be Tommy Douglas of pharmacare and start it here, or whoever is the next government, the minister can start it in Ontario, and it can become national. And hopefully the national government, our federal government, will see it right in the next elections to also go for it.
I can get you to weigh in on the NDP plan to cover a more limited number of drugs for all ages.
We did a comparison, and we can send, we will be happy to send that to you. What we are saying in the go forward is that wherever we start, where we want to go in the 4 years, is all essential drugs, so not just a few, and not only for the 25 and under, but for everybody, and without mean testing, user fees, etc. Again, because the research shows that actually is more effective.
So you're talking all the drugs like on the formulary, not
Yes.
just 100.
Yes.
Can you weigh in overall on on this government's record on the health file?
Well, I would say this government has made some very important health system changes. Overall, I think the release of Patients First that took a whole of system view in terms of the changes that need to happen across the system. I would say, of course, the focus on primary care, as we've laid out in our platform in terms of routing care coordination in primary care will make a huge difference. So we really want to see that continue to advance. I believe we haven't seen the movement we wanted to see on the issue of RN replacement. That's critical. We know that the RN component of the workforce is a huge component here in the province, and we want to optimize the role of RNs and NPs in this province. So, yes, I believe this current government has done well, but as you can see by our platform, we would love to see many of the areas continue to advance, whatever party comes into power.
It probably in the areas, to augment Carol's comments, in the areas of social determinants has been good progress. This government and the previous one, don't forget that they were 8 years, and some of us that have been in this for some time cannot forget 8 years of minimum wage freeze. So when that was lifted and the continuation, we now need to see it continue. We cannot afford to again go back to, so social determinants, housing needs to improve, environmental, big file that they have advanced. Again, huge more work to do, but I will concur with Carol. The issue of RN replacement is serious, and it's serious because the research shows that. Similar to your question on pharmacare, the research shows that decreasing the number of RNs results in more complications, which are more costly. So it costs more and produces less health.
So I know we have to wrap up. Thank you all very much for coming this morning. I would encourage you to pick up a copy of our platform, Improving Health for All, and share it with your colleagues. There, as you've heard this morning, are important recommendations for policy advancement for all parties to consider in their platform. So thank you so much on behalf of Doris and I for coming.